Okay, so what we're going to do now is going to be the basis for everything that I want you to do whenever you do anything physical. So first thing you're going to do is you're going to find ideal positioning. And when we first start doing it, you're going to do what we're going to do on the floor or with your back against a wall or a tree or whatever you can find that'll give you some tactile sensation to tell where in your body you need to be. So bend both knees, plant the feet on the table, and you want to have it lined up so your heel, your knee, and your sit bone are kind of straight like this. And that you feel like your feet are in a place where you feel like you're strong. Then you're going to tilt the pelvis backwards and forwards 3 times. So go ahead and go the other way with the pelvis. And then go this way, and then lift up here. Good. And then go backwards. And then one more time. And then find the middle position between going backwards and forwards. Okay. Then hands at your sides. Think about making the shoulders really nice and wide. Let me put this headpiece down just a little bit. Okay. So ideal positioning. Now, the powerhouse. The powerhouse is a combination of 3 things. First, breathing in a specific way. Second, contracting a deep abdominal muscle called the transverse abdominis. And third, contracting the muscles of the pelvic floor. So first, the breath. It's going to be into the nose, out through the mouth, through pursed lips and tongue. So it's going to look and sound like this. Shh. So you're actually using your tongue to slow the air coming out, like you're telling someone to be quiet. Okay, now abdominal muscles. 3 layers of abdominal muscles. We have the rectus abdominis, the abdominal obliques, and then the one we are concerned with right now, the transverse abdominis, called transverse because they go transversely across the lower belly. And what they do is they draw the lower belly back towards the spine. So if you take 2 fingers right here, so right there you find the pointy hip bone, and then you roll just to the inside, like right there. I want to feel this side, so let my hand come here. So now take that breath in, and as you breathe out, try and draw the lower belly back towards the spine. Shh. Keep going, keep going, keep going. Push, 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 push. So you're not really getting a great contraction, but we're going to add the pelvic floor next, and we'll see if that helps the transverse abdominis. So ever heard of Kegel exercises? That's essentially what we're going to do. So the pelvic floor muscle sits here. The urethra, the vagina, and the anus all pass through it. When you contract that muscle, it moves up towards your head. 2 cues to help people get connected to their pelvic floor muscles are: 1, stopping a pee in the middle of peeing, but we don't want people to do that on a regular basis because that does promote urinary tract infections. And the other one is holding in a fart. Can you contract your pelvic floor muscles? Okay. So now take that breath in, breathe out, draw the lower belly in, lift the pelvic floor up. Keep going. Blow, blow, blow. More. Keep going. Push, push, push every last bit of air out. Feel this kind of starting to get more contracting as you're doing that. See if you can make that happen a little bit earlier again. Breath in. Shh. Better. Again. Shh. Okay. So now what we want to do is we want to start adding some motion. Let me stop this and we'll just restart it.